Your blood pressure number is lying to you. Not sometimes. Every single time you sit in that doctor's office chair, here's what I mean. That reading your doctor takes, the one where you're sitting still, feet flat on the floor, arm at heart level, nice and calm, that number tells you exactly one thing. What your blood pressure is doing in a perfectly controlled moment that looks nothing like your actual life. It doesn't tell you what happens when you lean down to pick up a grandchild. It doesn't tell you what happens at 3 o'clock when you shuffle to the bathroom half asleep. And it definitely doesn't tell you what happens during what researchers are now calling the morning danger window. A 90-minute stretch after waking up when your cardiovascular system is under more stress than at any other point in the day. I've spent months combing through studies most people will never read. And what I found is going to fundamentally change how you think about blood pressure after 70, not just the target number. Everyone argues about that. I'm talking about when that number matters, why the same reading can be safe or deadly depending on the time of day, and a phenomenon called reverse risk that researchers discovered when they realized the healthiest seniors didn't have the lowest blood pressure. They had something far more interesting. Stay with me for the next 20 minutes. By the end, you'll know things about your own cardiovascular system that most people don't learn until something goes wrong. And I'll give you a 2-week tracking method that's more revealing than anything your doctor is currently measuring. Before we get into this, I need to know who I'm talking to. Drop 2 things in the comments. Your age and how many blood pressure medications you're currently taking. 0 counts. I'm asking because what I'm about to share hits differently depending on whether you're managing 1 medication or 4. And if you've ever had a moment where you stood up and the world went gray for a second, like someone dimmed the lights behind your eyes, write the word gray next to your number. You'll see exactly why that detail matters in about 4 minutes. I want you to think about the thermostat in your house for a second. If you set it to 68 degrees in a well-insulated home with good windows, everything runs smoothly. But set that same thermostat to 68 in a drafty old farmhouse with thin walls and gaps under the doors. The furnace is going to run nonstop, burn through fuel, and still never keep the house comfortable. Same target number, completely different result. Your cardiovascular system works the same way. At 45, your blood vessels are like that well-insulated house. Flexible, responsive, efficient. A blood pressure of 120/80 keeps everything humming along beautifully. But by 78, those vessels have changed. They've stiffened. The internal lining has thickened. The tiny pressure sensors embedded in your artery walls called baroreceptors have gotten slower, like smoke detectors with aging batteries. And the organs that clear medications from your blood, your liver, and kidneys are processing at maybe 60 to 70% of their younger capacity. So when a doctor pushes that same 120/80 target on an older body, it's like setting a drafty farmhouse thermostat to 68 and wondering why things start breaking. You're asking the system to maintain a number it wasn't designed to hold anymore. The furnace, your heart has to work harder. The pipes, your vessels can't deliver enough flow. And the rooms furthest from the furnace, your brain, your kidneys, start getting cold. This isn't theory. A major analysis published in JAMA Internal Medicine tracked over 15,000 adults past age 75 for 5 years. They sorted participants by their average systolic blood pressure and then watched what happened. The results challenged decades of conventional wisdom. The group maintaining pressure below 120, they experienced a 28% increase in serious falls that required hospitalization. Their rate of acute kidney injury climbed. And here's the number that should stop everyone in their tracks. Their overall death rate was 14% higher than the group sitting at 130 to 140. The people with so-called imperfect numbers were outliving the people with textbook perfect numbers. Meanwhile, the group above 150 had predictably worse outcomes. More strokes, more heart events. No surprise there. But the revelation wasn't at the top end. It was at the bottom. For the first time, we had large-scale evidence that pushing blood pressure too low in seniors was just as dangerous as letting it stay too high. The risk curve isn't a straight line going down. It's a U-shape, and the safest spot at the bottom of that U is higher than what most doctors' office posters tell you. Now, here's something your competitor's video isn't going to tell you. And this, in my opinion, is the most under-discussed danger in senior blood pressure management. Scratch that. Let me rephrase. Here's what almost nobody in the wellness space is talking about yet, even though cardiologists have known about it for years. It's called the morning blood pressure surge. Between roughly 4 and 9 o'clock your body goes through a hormonal shift. Cortisol spikes. Adrenaline ramps up. Your nervous system essentially flips from nighttime rest mode to daytime go mode. In a younger person, this transition is smooth. Blood pressure rises gradually, vessels adjust, and you barely notice. But in an older adult, especially one on blood pressure medications that were wearing off through the night, this morning surge can be dramatic. Your pressure might be sitting at 108/62 at 3 o'clock, dangerously low, by the way, while you're sleeping and your brain is trying to consolidate memories. Then by 7 a, it rockets up to 165/92 as your body dumps stress hormones into your bloodstream. That swing from too low overnight to too high in the morning is what researchers call blood pressure variability. And emerging evidence suggests it might be more predictive of heart attacks and strokes in seniors than your average blood pressure number. Think about it like this. A river that flows steadily at a moderate pace erodes very little, but a river that alternates between a trickle and a flood tears up the banks. Your blood vessels are those banks. A study in the journal Hypertension followed over 6,000 older adults and found that those with the highest morning surge, a jump of 40 or more points systolic between nighttime and morning, had nearly double the stroke risk compared to those with a gentler rise, regardless of what their average blood pressure was. Read that again. The people with normal average blood pressure but wild morning swings were at greater risk than people with slightly elevated but steady numbers. This is why a single office reading at 2 p. on a Tuesday tells you almost nothing about what's actually happening in your cardiovascular system. It's like checking the weather at noon and assuming that's what it was like at midnight. Your blood pressure has a life of its own across 24 hours. And understanding that rhythm is worth more than obsessing over one static number. Falls and fractures get all the attention when we talk about overtreating blood pressure in seniors. And rightfully so. A broken hip at 80 can be devastating. But there's a quieter cost that's arguably even more frightening, and it's happening above the neck. Your brain is a glutton. It makes up about 2% of your body weight, but demands roughly 20% of your total blood flow. It's the most blood-hungry organ you own. And unlike your muscles, which can tolerate short periods of reduced flow, your brain starts complaining within seconds when supply drops. When blood pressure is pushed too low in an older adult, the brain doesn't get enough perfusion. Not enough to cause a stroke necessarily, but enough to create a chronic low-grade shortage. Think of it as a brownout versus a blackout. The lights don't go completely dark, but they flicker, they dim, things don't work quite right. A landmark study published in JMA Internal Medicine examined over 8 in 500 adults with an average age of 76. They found that those whose systolic blood pressure was aggressively lowered below 120 showed measurably faster cognitive decline over 3 years compared to those maintained between 130 and 145. The differences weren't dramatic month to month, but compounded over years. The gap widened significantly. Memory tests, processing speed, executive function, the ability to plan, organize, and make decisions. All of it eroded faster in the aggressively treated group. And here's the cruel irony. Many people dismiss early signs of cognitive trouble as just getting older. Your thinking gets a little foggy. You walk into a room and forget why. You can't recall a name that was on the tip of your tongue. So you shrug and say, well, I'm 78. What do you expect? But in some cases, that fog isn't aging. It's underperfusion. Your brain isn't getting enough fuel because your blood pressure has been medicated down to a number that makes the chart look good, but leaves your neurons running on fumes. I want to be very clear here. I am not telling you to stop your medication. What I'm telling you is that cognitive symptoms, persistent brain fog, trouble concentrating, word-finding difficulties that seem new deserve a serious conversation with your doctor about whether your blood pressure target is still appropriate. These aren't just annoyances. They're data points, and your doctor needs to hear them. All right, I know you came here for specifics, so let's get into them. But I need to frame this properly first. These are evidence-based ranges drawn from multiple large studies. They are not commandments. Your individual target depends on your full medical picture, your activity level, your medication tolerance, and a dozen other factors. Use these as conversation starters with your doctor, not as prescriptions. For adults aged 65 to 74 who are generally healthy and active, a systolic range of 130 to 140 appears to offer the best balance between cardiovascular protection and adequate organ perfusion. This is slightly above what many guidelines still recommend, but the geriatric-specific data supports it. For adults aged 75 to 84 in reasonable health, the evidence favors a systolic range of 135 to 145. This accounts for increased arterial stiffness, slower baroreceptor response, and reduced medication clearance. If your doctor is pushing you toward 120 and you're 79, this is a conversation worth having. For adults over 85 or for anyone who is frail regardless of age, a systolic range of 140 to 150 may provide the best combination of cardiovascular safety and fall prevention. At this stage of life, preserving mobility and independence often matters more than chasing a number. Now, the bottom number, diastolic, gets almost no attention in popular health content, but it matters enormously for older adults. Your diastolic pressure is the reading during the moment your heart relaxes between beats. That's when your heart muscle itself receives blood. If diastolic drops below 60 consistently, your heart is essentially being shortchanged during its own rest period. The sweet spot for seniors is between 70 and 85. If yours is regularly in the 50s or low 60s, that's worth flagging even if your top number looks decent. And here's something no blood pressure chart will show you. What matters even more than any single number is the stability of that number throughout the day. A person with a steady 138/78 is in a much safer position than someone whose pressure bounces between 110 and 170 depending on the hour. Consistency is the hidden metric, and measuring it requires more than an occasional office visit. This is the part I'm most excited to share because it's something you can start tonight and it will give you a clearer picture of your cardiovascular health than most routine checkups provide. I call it the 2-week blueprint. You'll need a basic home blood pressure monitor. Any pharmacy carries them for around $30 and a simple notebook. Here's the protocol. Every morning, within 30 minutes of waking up before coffee, before medications, take your blood pressure while sitting. Write it down. This captures your morning surge and tells you what your body is doing on its own before any medication kicks in. Every evening around the same time, take it again. This shows you how your medications and daily activity have affected your numbers throughout the day. Twice during the 2 weeks, let's say day 3 and day 10, perform the orthostatic test. Here's how. Lie flat for 5 full minutes. Take your pressure while lying down. Then stand up and take it again immediately. If the top number drops by more than 20 points, or the bottom number drops by more than 10, that's orthostatic hypotension. Your body isn't compensating when you change position. That finding alone is more clinically useful than a dozen office readings. Let me give you a concrete example. Say your morning readings average 152/84. Your evening readings average 128/72. That's a 24-point swing in systolic. Your blood pressure isn't just high or normal, it's volatile. And your orthostatic test on day 3 shows a lying reading of 126/74 that drops to 94/58 when you stand. That's a 32-point systolic collapse. Now you're walking into your doctor's office with a story those numbers tell. Your medication might be wearing off by morning and hitting too hard by evening. This kind of data transforms your appointment from a 5-minute blood pressure check into a meaningful clinical conversation. Doctors love when patients bring organized home readings. It gives them information they literally cannot get during a 15-minute office visit. You're not replacing your doctor's expertise. You're arming it. Let me share a scenario that perfectly illustrates why individualized treatment matters more than universal targets. Imagine a married couple, both 79, both measured at 150/86 at their last shared appointment. Same doctor, same numbers. The husband has well-managed type 2 diabetes, mild kidney disease, and had a stent placed 4 years ago. The wife volunteers 3 mornings a week, walks 2 miles most evenings, and takes no medications at all. Their doctor, following standard guidelines, recommends the same target for both. Get below 130. For the wife, moderate lifestyle adjustments, a bit less sodium, a bit more potassium-rich food. Stress management might bring her to 140/80 naturally, which for a healthy, active 79-year-old is a range associated with excellent outcomes. No medication needed, no risk introduced. The husband is a different equation entirely. His kidneys are already compromised. Aggressive medication to reach 130 could further restrict blood flow to those kidneys, worsening the very condition they're trying to protect him from. His diabetes affects how his blood vessels respond to pressure changes. A more careful target may be 138/142, achieved slowly with 1 carefully monitored medication rather than 3, respects the complexity of his body. Same age, same starting number, completely different paths to health. This is what personalized medicine looks like, and you have every right to expect it from your care team. Let me pull everything together into 5 things you can act on immediately. 1. Start the 2 blueprint tonight. Morning readings, evening readings, 2 orthostatic tests. Write everything in a notebook. This single step will give you and your doctor more actionable data than you've probably ever had. 2. Pay attention to the gap between your morning and evening numbers. If the swing is more than 20 points systolic, your medication timing might need adjustment. That's a conversation to bring to your next appointment. 3. Track your symptoms alongside your numbers. Dizzy when standing? Write it next to that reading. Brain fog after lunch? Note the time. Exhausted by 3 p. Log it. Symptoms without numbers are easy to dismiss. Numbers without symptoms are incomplete. Together, they tell your complete story. 4. Schedule a dedicated blood pressure review with your doctor, not part of a routine checkup where it gets 30 seconds. A specific appointment where you bring your 2 log and say, I want to discuss whether my current target and medication plan are optimized for my age and my body. 5. Hydrate. This sounds almost too simple, but mild dehydration is epidemic among older adults, and it directly affects blood pressure readings and variability. Many seniors don't feel thirst as strongly as they used to, so they chronically underdrink. Dehydration concentrates your blood, which can temporarily raise readings and mask the fact that your actual circulating volume is low. Staying well hydrated, 6 to 8 glasses of water daily, adjusted for your doctor's recommendations. If you have heart or kidney conditions, stabilizes your pressure and gives you more accurate readings. Let me tell you what you now know that most people never learn until it's too late. You know that a blood pressure reading taken once in a doctor's office is a snapshot, not a portrait. You know that the morning hours carry a hidden cardiovascular risk that almost nobody is measuring. You understand that pushing blood pressure too low after 75 doesn't just increase fall risk. It can quietly erode the sharpness of your mind. And you have a practical, evidence-based tracking system you can start using tonight that will transform the quality of your conversations with your healthcare team. That's not just information, that's leverage, the kind that turns you from a passive patient into an active partner in your own health. If this video shifted something for you, if there was a moment where you thought, wait, that explains what I've been feeling, drop the word clarity in the comments. I read every single one, and please share this with someone you care about who's over 65. A parent, a spouse, a friend. This might be the 20 minutes that changes how they manage the next decade of their health. Hit subscribe if you haven't, because next week I'm breaking down the 3 supplements that research actually supports for blood pressure stability in seniors and the 2 best-selling ones that are basically expensive water. You won't want to miss it. Until then, remember, the best blood pressure for you is the one that keeps your brain sharp, your balance steady, and your life your own, not the one that looks good on a chart. This video is for educational and informational purposes only and is not intended as medical advice. Blood pressure management should be individualized based on your complete medical history, current health status, and other factors. Never adjust or discontinue medications without consulting your healthcare provider. The information presented is based on current research, but should not replace professional medical care.